Hello and welcome to 72 Dragons. Today we have the pleasure of speaking with Andrea Portillo Medeiros. Welcome to this interview, Andrea. It is an honor and pleasure to have you with us today.
Hi, Pietro. Thank you for having me today.
Wonderful. Andrea Portillo Medeiros is an accomplished professional in the field of public health with a diverse career that spans nearly a decade. She is currently serving as the Senior Director of Public Health and Policy at the Bone Health and Osteoporosis Foundation. She showcased her dedication to public health by serving in different roles in the American Public Health Association's Public Health Education and Health Promotion section. Her involvement in various public health committees, including the Latino Caucus for Public Health, reflects her commitment to her profession. My name is Dr. Pietro Aparicio from 72 Dragons. Thank you for joining us and for sharing your experiences with us. Without any further ado, let's begin. Andrea, can you provide an overview of your career journey in public health from your early roles to your current position as the Senior Director of Public Health and Policy at the Bone Health and Osteoporosis Foundation?
Yes, of course. So I first started off my bachelor's in health sciences. It's been a few years, in 2013, I believe. And then I actually started as an intern at the National Osteoporosis Foundation, which we rebranded in 2021. So when I first began as an intern, I was under the marketing and communications role. And I learned a bunch of information from nonprofits of how they worked. I also did many informational interviews to find out how people got to their field, which led me to get my master's in public health. So while I applied for my master's in public health, I still worked for NOF, which is BHOF. And I interviewed people at American Red Cross and other nonprofits and realized I was really interested in the field. So I stayed there and I worked actually from 2014 as an intern all the way to becoming a manager and director and senior director at BHOF. But during my whole transition there, I also moved to California for a few years. And while I worked in California, I actually worked for a community-based nonprofit as a prevention services director. So while I was over there, I worked in the HIV field, doing substance abuse as well, and working in the jails. At the same time, I actually was still consulting with BHOF. So I still kept my role there. So I've been in the bone health field for almost a decade now, and also had experience now in the HIV field, substance use, and also I actually did work in the diabetes field for a little bit while I was in California as well. Then I actually came back to DC and then became a full-time director at BHOF. So it's been back and forth, but I've still been in the bone health field, and I've been very interested because of my background. So my grandmother has osteoporosis, my great-grandmother has osteoporosis, and my mom has osteopenia. So I've been interested in myself because I know genetically I'm predisposed to basically have osteoporosis as well, but I'm trying my best to help myself and help other people.
Amazing. It's been a long relationship with the organization. Can you share about Bone Health and Osteoporosis Foundation's work and their mission? In addition, as the Senior Director of Public Health and Policy at the Bone Health and Osteoporosis Foundation, please share some of the key initiatives or projects you're hoping to achieve.
Yeah, of course. So our main mission is basically to prevent osteoporosis and broken bones. So we have its primary prevention, basically you do not want to break any bones in the first place, and secondary prevention. Currently, we're more on secondary prevention due to when you want to break a hip, you're more likely to end up in the hospital stay, end up breaking more bones. So we want to prevent that start. And now we're working towards primary prevention as well, towards kids and basically teaching them how strong bones can keep you healthy for life. Because at a certain point in your life, you hit peak bone mass. So that's around age 30. So you build all your bone you can at that point. And then afterwards, you basically want to maintain that bone. So we want to make sure we get that younger audience involved to build all the bone you can and then maintain it afterwards so we don't end up breaking. Because right now it's basically 1 in 2 women over 50 and 1 in 4 men will break a bone due to osteoporosis. So I know my odds are, again, not well, but if we keep working towards it, we can find better ways, because there is medication, there is prevention, there's ways we can be stronger altogether. And okay, just a little background too. Osteoporosis itself, because people might not know what it is basically means your bones become weak. And so this leads to a loss of independence, which people don't think about. You think it's more of an aging disease, but if you think of long term, you want to build all your bone early on. So it's actually more a childhood disease that manifests when you're older. So overall at BHOF, we do clinical training, which includes training professionals on our learning management system, on parts of like fracture liaison services, which we do a lot on. Basically, if people end up in the hospital, having that connection to make sure they don't just leave the hospital and they're done. There's someone connecting them afterwards somewhere else. You have a nurse calling you, you have another appointment going on, you have your DEXA scan happening, because if not, we just end up back in the same cycle all over again. Our patient education part is we have educational webinars. We also do many awareness programs. So during May, that's Osteoporosis Awareness and Prevention Month. And we basically are working on the policy side to get law state resolution. So governors mentioning the proclamation of making May Osteoporosis Awareness and Prevention Month, state resolutions through our representatives mentioning as well. So we get that awareness out so people know what's going on. Because with the patient awareness, then we can actually lead to patients knowing what's going on and get more preventions done for them. We also do a lot of advocacy, as I mentioned. We have our policy institute. So we have a coalition to strengthen bone health, which is around 25 to 27 members currently. And that includes women's groups, aging groups, family caregivers, and other comorbid conditions, because we all know the importance of strengthening bone health. And one of the programs, I keep going forever. One I work on specifically is Bone Fit as well, which Bone Fit is actually from Osteoporosis Canada, but we've transferred over as well some parts. So it's training physical therapists, personal trainers, exercise physiologists to basically know what the best way to treat osteoporosis and safe and evidence-based programming, so they know what to do in their practice to help them long term.
Very important work that I think we all can relate to. Now, as the chair of the Public Health Education and Health Promotion section at the American Public Health Association, APHA, what projects are you currently working on? And please elaborate, particularly for those in the audience who are not very familiar with APHA.
It's been a long time now. When I first got involved, I believe in starting in 2015, I had to get involved to find out what are the working parts. So I got first involved in communications, and through there got governing counselors, other positions leading me to program planning, and then becoming chair. So as chair, I want to make sure that everyone actually knows what's happening in the section and what's happening at APHA, so they know where to get connected to and where they find their home. So APHA overall has over 30 sections. The Public Health Education and Health Promotion section is one of the biggest ones. We have thousands of members. So with that, we get a lot of program sessions during the conference. And on my part as chair, I also want to get a lot of more people involved in leadership roles. So when I first got involved, I was a student, so I just had no idea how to get involved. So I want to connect all those students to committees and getting them more involved to become chairs of those committees and becoming chairs of sections and so on at APHA, so they can actually find their family and find what drives them to keep going.
Amazing. That's a large responsibility with all those members. Now, you also are a member of the Latino Caucus for Public Health. Can you share some highlights from your role as the co-chair of the Young Professionals Development Committee for the Latino Caucus for Public Health and your involvement in the Sana Sana, Latinos in Public Health podcast?
I was so excited when I found Latinos for in general. I did not know the caucus existed for a few years, and I kept getting more and more involved. So when it was during COVID times that we actually started the podcast, and we realized, okay, we need to find a way to connect Latinos and public health together. And we started thinking of different ideas. We're like, okay, what's a fun idea that we can Latinos get? So Sana Sana kept coming up just because we kept thinking about it. So my friend actually designed the Sana Sana frog image for us. I'm like, oh, thank you so much. And it still makes me so happy seeing it every time. But the best part for me was actually connecting everyone together and hearing everyone's stories, because we all kind of started the same part of finding out, okay, public health is just, are you just a doctor or different parts? And then we realized there are so many parts of public health. Everything is public health. And you will hear in everyone's stories. They mentioned the podcast. And then just working with everyone on the board and everyone in the committees, everyone is so excited to work together. And you see all the energy pumping up, and we just want to like, just keep going no matter what. And it's just, it makes your day.
Sounds very exciting as well. Now, what are your future goals in the field of public health, and what advice would you give to aspiring public health professionals who are looking to make a meaningful impact in the field?
So one thing we for sure mentioned in the podcast, and I've heard from everyone else, is mentoring and connecting. Because if you can't find that connection, you're just kind of on your own. You don't know where to go. And connecting doesn't mean just like you have to network in person. You can network online, you can network in person, you can network during the APHA conference, during our podcast. And overall, like finding Facebook groups, finding there's so many different parts now. For even APHA Lead, the new connection part they have, it's working really well. I'll get messages from random people, also on LinkedIn too. Like everyone is free to message me anywhere, and sometimes it might be slower just because there's so many kids in my house now. But it's so much fun hearing everyone's stories. So it's just getting that connection down. And then also finding out like, where is your family? Is your family at Latino Caucus? Is your family at a section of APHA? Is it maybe your family at home actually is fully related to public health? And learning all that, you just have to find where your home is.
Where is your family? Where is your home? Thank you. Andrea, thank you for your time. Your contributions to the field and active involvement in the American Public Health Association and the Latino Caucus for Public Health are truly an example to follow for many others who want their work to be meaningful. Thank you very much.
Thank you for having me.